Fracking and its connection to breast cancer. Thank you so much for joining us today. My name is Saru Kaiser, and I'm the Education and Mobilization Coordinator here at Breast Cancer Action. Joining me on the webinar today, our presenters will be Karen Joy Miller, the Environmental Chair with the New York State Breast Cancer Network and member organization Huntington Breast Cancer Action Coalition, Incorporated. Also, Jennifer Krill, Executive Director at Earthworks, and last but not least, Annie Sarter, Policy and Campaigns Coordinator here at Breast Cancer Action. Before we get started, there's a few quick announcements. I wanted to let you know about our next upcoming webinar next month, which will focus on breast cancer media literacy. Our presenters will be Gary Schweitzer from Health News Review and Mandy Starr, who's also a reviewer for Health News Review. And that's going to be on May 29th and May 30th. Breast Cancer Action doesn't take money from any corporation that profits from or contributes to the breast cancer epidemic. Our work is largely supported by individual donors. Please consider making a $25 donation today to support work like these educational webinars. The presentation of fracking and its connection to breast cancer will last about 40 minutes, and we'll try to leave about 15 to 20 minutes at the end for questions. Everyone except the speakers will be muted during the webinar to cut down on any background noise and to ensure that we can all hear well. We want you to get involved with Breast Cancer Action. This webinar is a great way to do that. Please stay tuned for other ways we'll mention later on. So I'm going to go over our agenda for today. So Jennifer will explain the process of fracking and why it's harmful. She's also going to talk about how fracking introduces health risks into our communities. Then Karen will talk about what we know about breast cancer and fracking, and she'll also talk a little bit about the precautionary approach and what it looks like. And last, Annie will talk about Breast Cancer Action's involvement in the anti-fracking movement and how you can get involved. Breast Cancer Action was founded in 1990 by a group of women who were frustrated with the lack of information about breast cancer. Our founders, only one of whom is still alive today, knew that their private medical crises were part of a larger public health emergency, and that the experiences of those dealing with breast cancer needed to be heard to address the crises. Breast Cancer Action's mission is to carry the voices of people affected by breast cancer to inspire and compel the changes necessary to end the epidemic. Our advocacy is conducted through a social justice lens because the politics and policies of breast cancer disproportionately affect poor women and women of color. Breast Cancer Action's independence from pharmaceutical company funding puts us in a unique position to address issues of health equity and exposures to toxins in our environment, and to put the needs of patients before pharmaceutical company profits. We have three main program priorities. The first is putting patients first, where we advocate at the Food and Drug Administration in favor of treatments that are less toxic, more effective, and less expensive than those already available. We also provide information about breast cancer to anyone who needs it. Second is creating healthy environments, where we work to reduce the involuntary exposures people encounter that put them at risk for breast cancer by holding corporations accountable for unhealthy products and practices. We also support legislation that would better protect us from chemicals in our environment and that would make personal care products safer. And the last is eliminating social inequities related to breast cancer, where we work to create awareness that it is not just genes, but social injustices, political, economic, and racial inequalities that lead to disparities in breast cancer incidence and outcomes. Our first presenter is Jennifer Krill. Jennifer Krill joined Earthworks, an organization dedicated to protecting communities and the environment from the impacts of irresponsible mineral and energy development, as Executive Director in January 2010. She was the Program Director at Rainforest Action Network and currently serves on the boards of Plug-in America and the Labor Network for Sustainability, also the Advisory Board of the Western Mining Action Network, and as an alternate member of the U.S. Extractive Industries Transparency Initiative. Jennifer has experience on both the supply and demand side of the energy market, including battling coal, oil, natural gas, and uranium extraction and campaigning for energy efficiency, renewables, bike transit, mass transit, and zero-emission vehicles. Welcome, Jennifer. Also joining us.
Thank you for having me.
Is Karen Joy Miller. For the last 20 years, Karen has been involved with various breast cancer groups. She is invested in public health in general, looking at the environment and the role it plays in creating and exacerbating a chain that leads to many life-altering diseases. Karen Joy Miller is the founder and president of Huntington Breast Cancer Action Coalition, a grassroots community organization established in 1992 designed to educate people on awareness and prevention and help those coping with the disease. She is also a founding member of the New York State Breast Cancer Network, the Long Island Breast Cancer Network, and Prevention is the Cure. Karen has served as an advocate for public health since a breast cancer diagnosis in 1987. Welcome, Karen.
Hi, and thank you for having us.
And our last presenter is Annie Sarter. Annie is a core member of the Breast Cancer Act program team and leads Breast Cancer Action's national campaigns and policy advocacy. Annie's activist background includes environmental and social justice campaigning to slow climate change, demand corporate accountability, and stand up for the rights of people most impacted by greed and inequality. A women's studies major from the University of Washington, Annie is inspired by Breast Cancer Action's unwavering commitment to women's health. Welcome, Annie. Now I'm going to turn it over to Jennifer.
All right. I think I have it here. And everybody can hear me all right?
Yep.
I'm going to be really nervous when she turns it over to me, so come on. All right, great. So thank you again, Saru and Annie, and thanks very much to all of you for joining us today. I'm really looking forward to this talk and to the discussion that we're going to have at the end. I wanted to begin by explaining a little bit about what hydraulic fracturing is. And if you go online to Google and Google Images, you can do a search and find a lot of different diagrams that explain what is going on when we, in this process that we refer to as hydraulic fracturing. The basic synopsis is that deep under the earth, a mile and sometimes 2 miles down below the surface, there are formations of oil and gas that don't exist as solid oil or solid gas. They instead exist as tiny bubbles within rock known as shale. Sometimes they exist in tiny bubbles in sand formations or other types of formations. Most of what we're going to be talking about when we refer to fracking is shale rock. And water is pumped down into the shale rock under pressure in order to force the bubbles to the rock to fracture and the bubbles to pop and the little and join together, and then and then natural gas or oil comes back out through the formation. When this technology was being developed, it took a long time to get to the point where we figured out how to do this. One of the things that happened is that it's kind of warm down there deep in the earth. And so as a result, you would have bacterial growth into the drill bore, and then you would have this problem with the fungus or the bacterial growth plugging the hole. So they began adding biocides. There's some mechanics involved at the top, and for that you needed chemicals that would prevent the machine from rusting. And gradually, the number of chemicals that were required to be injected in with the water came to a list of some 600 chemicals. About 200 tanker trucks of water, of fracking fluid, are required to fracture a well. A little bit more, a little bit less, depending on the formation and where the well is. And of those 200 tanker trucks full of water, about 200 tanker trucks full of fluid, about 5 to 10 of those tanker trucks are full of chemicals. Most of those chemicals are toxic chemicals. Now, in the landscape where fracking occurs, there are a whole array of impacts. One of the impacts that we watch very closely is impacts on water. The proximity of the drill pad where the fracturing is occurring in this instance is very close to a creek in Bradford County, Pennsylvania. There's also the impact of water from the produced water that comes up. So as I was describing in that earlier slide, the 200 tanker trucks of fracking fluid pump the fluid into the earth. Between 25 and 75% of that fluid stays in the formation. It doesn't come up. What does come back up is incredibly problematic to deal with. It's known as produced water or toxic wastewater, and it has to be put into these usually pits. Sometimes they use tanks on the site where the fracturing is occurring. And where it sits in these pits, sometimes that's just where it ends up staying and it gradually evaporates away. In some states, Wyoming, for example, you are not required to use a liner on the pit. In some cases, there's little enforcement or inspection, and so you may have the liner breaking. In that case, the produced water is allowed to seep into the ground, and thus it is a possible pathway for contamination of groundwater. Once you're done with using the water in the pits, if the pits are cleaned up, then you can do several things with it. You can take the produced water and recycle it and use it for more fracking. You can also treat it in special chemically designed fracking wastewater treatment plants. There are very, very few of those, and they're expensive. So most of what we see happening is that the produced water is sent to municipal landfills. A truck full of produced water that was laced with naturally occurring radioactive particles was turned away at a Pennsylvania landfill last week and sent back to the frack pad where the fracking was occurring. It could be sent into sewage treatment plants. It can be injected into even deeper formations in the EPA's underground injection program. This particular injection of wastewater has been linked to earthquakes in New Mexico, Oklahoma, Arkansas, and Ohio. So what we do with the produced water is a big deal, and it is a big problem with fracking. Another impact that we see growing, especially out west, but now you're seeing it east as the build-out is increasing in Pennsylvania. Some of the counties in Pennsylvania are starting to look like these slides from Colorado. The spacing of well sites gets to 20 acres and in some formations even 10 acres apart. The pads themselves are 5 acres. So you can end up in a situation where you have a landscape that is so littered with well pads that it's no longer a natural landscape. If you've flown into Dallas-Fort Worth Airport recently and had a window seat and looked out your window, you may have seen these well pads and wondered, gosh, what are all those swimming pools all over the landscape? They're not swimming pools. They're produced water pits. And those well pads are not any place that you want to be going near. Another impact that we see, oops, look at that. It's working really quickly now. Another impact that we see and are very concerned about is the climate footprint of oil and gas operations. One study, this came out in 2011 out of Cornell University, found that first of all, we aren't adequately measuring the fugitive and intentional emissions from oil and gas development. And that means every one of those well pads, every one of those well heads, you have the possibility for some gas to leak. And then those pads are connected by feeder pipes to larger pipelines, and at each one of those connections you have possibilities of more gas to leak. Then the pipelines go to compressor stations, and then there's more gas leaking. All of those leaks, all up completely down the supply chain, lead to, and up and down the supply chain lead to some significant greenhouse gas impacts. In fact, shale gas may have greater greenhouse gas emissions than conventional gas or other fossil fuels, and oil fracking is potentially even worse. Now, we usually say oil and gas together because almost every gas well produces some liquid, oil or hydrocarbon liquid, and every oil well produces some gas. But right now, the market for natural gas is pretty, it's a pretty big glut, and the price of natural gas is pretty low. As a result, it's not always economical to build a pipeline to each one of those well pads to collect the fugitive emissions of natural gas. And so what we do with it when that happens is that we flare it or we vent it into the air. For the next door neighbor, flaring is a big problem because you end up feeling like you're living in an industrial zone with all of these pads and all these wellheads flaring their natural gas all over the place. This is a little photo, a thumbnail of one flaring event going on in North Dakota. Cumulatively, the Bakken shale oil fields in North Dakota are now lighting up the night sky brighter than the cities of Minneapolis, St. Paul, and Chicago. And that is because of the flaring of natural gas that is not economical to bring to market in an oil field. They're fracking for the oil, the natural gas is the byproduct, and it's too cheap, and the companies are too cheap, but they're too interested in making profits to bring that natural gas to market. Now, there's a concern that comes up a lot, especially when we're talking about rural parts of the country. Well, I like to frame it as human rights. We have found chemicals detected in the air and in the water in the vicinity of shale oil and gas drilling, production, and distribution. And here's a short list of some of the ones that we have found. And this is just a snapshot of what's happening in a large scientific area, in a scientific study. If you look at what this means for the communities where this is going on, these chemicals are occurring in very close proximity to residential homes, to schools, to workplaces. The setbacks in the state of Texas for a frac rig for a gas well or an oil well is 120 feet from existing structures. You look out your kitchen window and you see a frac rig if you live on the Barnett Shale in Texas, and that's what this particular family experienced. And that in turn leads to significant health impacts. The reason why this is occurring comes down to a series of policy loopholes. Largely, the federal government has delegated control over regulating oil and gas production to the states. And the vehicle for doing that are loopholes in 7 of our core environmental laws. The Safe Drinking Water Act, Clean Air Act, Clean Water Act. The Resource Conservation and Recovery Act is the law that governs how hazardous wastes are handled in the United States. This is the 4th item on this slide, except for oil field and natural gas production wastes, which are exempt from the Resource Conservation and Recovery Act. This exemption alone and the one after it, CERCLA, our Superfund law, are the reasons why it is okay to put oil and gas drilling wastes in those toxic pits all across the country, every place that fracking is occurring. If that water had to be classified as hazardous waste, as it is, if those pits were potentially to be classified as Superfund sites with potential liabilities attached to them, then the industry wouldn't be able to get away with fracking and managing their wastes in the very irresponsible way that they're managing them. They're not even subject to the National Environmental Policy Act, which is why, particularly out west, the Bureau of Land Management is the largest holder of mineral rights in the country, and the Bureau of Land Management under the Department of Interior is not required to run oil and gas auctions through NEPA, the National Environmental Policy Act. And they don't even have to list on the toxic release inventory. This is happening, so thus the regulation has been delegated to the states. There are 34 oil and gas producing states in the United States. 830,000 active oil and gas wells across the U.S. onshore. There are 2,000 new wells drilled per month. 90% of those wells are fracked. This is a map of the plays where oil and gas is underway. This is only shale. This doesn't count some of the other types of plays. I mentioned earlier there's also tight sands formations and there's conventional as well as shale. But this shows you just a pretty good chunk of the impact that we're talking about here. And because of these impacts, what the oil and gas industry has been saying to us is no. These laws, we're exempt from them. You all, citizens of America, all of you people who might be suffering these impacts, you've got to yield to us. What's happening today is that more and more citizens are rising up, and whether they're concerned about water, health, climate, or their rights, they are saying, stop, oil and gas industry. We're not going to take this anymore. Here's a snapshot of what we're doing about it. As citizen activists, come on, snapshot, here we go. In the state of New York right now, there are over 100 communities that have passed bans or moratoria on oil and gas drilling or oil and gas fracking within the state of New York. There's still some conventional oil and gas drilling in New York, and New York is still going to suffer the impacts of fracking in Pennsylvania and surrounding states if we don't work hard on it in those states as well. But here you see just a shot of the landscape of an entire state saying, wait a minute, we're not going to have it here. And in doing so, all eyes are on New York. Now we're seeing movements for bans or moratoria on fracking in communities in other states like California and Colorado, New Mexico. The strongest property rights laws are in Texas. Some of the longest running bans on fracking in counties and states are in Texas, and we're trying to move those laws to other states. And then there are also a number of communities where maybe it's not politically doable to ban fracking, but those communities are rising up and saying, but they're not going to frack in our schools, and they're keeping this industry out of the harm's way of the people who live in those communities. And those efforts to reduce the harm from the industry are underway all across the country. Last year we had the first ever national action on fracking. We called it Stop the Frack Attack. And we said every place that we're going to that we can keep the industry out of, we are going to keep the industry out of. And every place where people are already being fracked, where people are already in harm's way, we're going to say we are not going to stand for sacrifice zones anymore. And we're going to work together to fight the oil and gas industry across the country. So that, I think, concludes what I was going to cover, and then I'll turn it right on over to Karen.
Thanks, Jennifer. That was a very clear picture and helps us to understand the implications of fracking. And thank you, Saru, for putting this together in Breast Cancer Action. I'm very happy to be speaking today on behalf of the New York State Breast Cancer Network, as well as the Huntington Breast Cancer Action Coalition. The network is a coalition of breast cancer grassroots community organizations from all around the state of New York, stretching from Buffalo to Long Island. The Environmental Committee put together a powerful, first-of-its-kind PowerPoint for the New York State Breast Cancer Network Advocacy Day on March 12, 2013. Laura Weinberg from the Great Neck Breast Cancer Coalition presented, and today we're so pleased to partner with BCA on this national call. Breast cancer can show up decades after exposure. Over the past years, scientists have had a greater understanding of the consequences of genetic and epigenetic mechanisms and how they can alter genes to promote cancer. We know that an alteration in a growth-promoting gene, known as an oncogene, can signal a cell to divide out of control, or an alteration to a tumor suppressor gene will signal a damaged cell to continue to divide rather than die. There are many particular patterns of gene alterations as well as many combinations of environmental exposures that make one person or another more susceptible to cancer. Scientists have identified hundreds of altered genes that contribute to tumor development. We know about the BRCA1 and the BRCA2 gene. What about other mechanisms that have been altered due to combined environmental exposures? We know that it can take more than 20 years for a tumor to be detected. Long-term studies are critical, and there have been no long-term studies on the safety of hydrofracking as it pertains to our health. We can't move forward without a full understanding of the effects of high-volume fracking, since it's a recent technology. There are many unknown toxic chemicals used in the fracking process, but many of these chemicals we do know can alter and damage genes that contribute to breast cancer. 25% of the known chemical fracking fluids are carcinogens. 37% are known endocrine disruptors that may lead to tumor formation. From nosebleeds to liver damage, folks who have been living near fracking wells have documented ill health effects they believe is due to this process. Significantly higher rates of breast cancer were seen near drilling sites in Texas. The true burden of environmentally induced cancers has been grossly underestimated, as stated in the 2010 annual report of the President's Cancer Panel. We know alterations in our genes can be inherited or acquired. Exposure to environmental toxins can cause mutations or genetic alterations. It only takes 5 alterations to transform a cell from normal to malignant. Researchers have witnessed a rise in the onset of early puberty, and it's a concern because the body's production of estrogen increases during sexual maturity. An important article was published under the Breast Cancer and the Environmental Centers program showing that between 2004 and 2006, twice as many Caucasian girls showed breast maturity at age 7 compared to 1997. Early onset of puberty is a risk factor for breast cancer. We take in many chemicals at a time. To understand how combined or multiple environmental exposures affect disease onset, scientists must assess the joint action of multiple environmental insults, chemicals as well as non-chemical stressors like behavior. What are the long-term health effects of mixtures of chemicals? What about timing of exposure? What about the dose? A paper published in Environmental Health Perspectives clearly shows that the combined efforts of endocrine-disrupting chemicals can be damaging even when each chemical is present in low doses, and that children with the highest levels of certain chemicals found in their blood led to less infectious fighting antibodies to keep diseases away. Exposure to toxic chemicals during a life course can increase our risk for breast cancer and additionally can create a persistent hypersensitivity that could cause a tumor occurrence in future generations. And that's here where we're speaking about the transgenerational effects. Who is at risk? In utero and pregnancy, we know that chemicals can cross the placenta and small doses can have a more toxic effect. In infancy and childhood, while our bodies are still developing, we know that babies drink more water per pound of body weight than an adult and breathe the air more rapidly. In puberty, there are dynamic hormonal changes that are taking place. Those of us living with chronic disease are affected. I'm letting the slide run. And the elderly are at risk. We know that it's all about us, and that timing is certainly everything. Jennifer spoke about chemicals, and I want to concentrate on radiation. Radiation is the only known cause of breast cancer. It is a known carcinogen. Radioactive substances, carcinogenic vapors, and toxic metals are released from shale when it's fracked. The wastewater produced in Pennsylvania and New York showed that 3,600 times more radioactivity than federal, showed 3,600 times more radioactivity than federal limits for drinking water, and 300 times over the limit of radioactivity than allowed at a nuclear plant facility. Knowing that radiation causes cancers of all types, the incidence of exposure connected with this new horizontal fracking process should be enough to ban the process. Whoops, sorry. Many of the fracking chemicals are a trade secret. The New York State Supplemental Generic Environmental Impact Statement, SGEIS, doesn't even address cancer risk in its literature. Industry has been known to drill under leased property to adjoining neighborhood properties. We know that 30 to 70% of spent fracking fluid is not recovered and it stays in the ground. Before we did speak about the 25% are linked to cancer and 37% are create endocrine disrupting hormones. Safe fracking is a fairy tale. The hormone melatonin is involved in the circadian regulation and facilitation of healthy and reparative sleep. Exposure to light at night on a regular basis leads to sleep disturbances and interferes with the release of melatonin. Dr. Richard Stevens published extensive articles on this subject. He had come to speak with activists during the Long Island Breast Cancer Study Project in the 1990s, where he discussed that in the absence of reparative sleep, the immune system was suppressed, and additionally there was an increased risk of developing a number of different types of cancer, including breast cancer. Once started, the fracking process is ongoing 24/7, and during that time, our beneficial sleep is interrupted. Early warnings about fracking. We see in children nosebleeds, gastrointestinal problems, vomiting. In adults, breathing difficulties, dizziness, nausea, sleep disturbances. If these are the immediate effects, what changes are happening to our bodies that will trigger future health consequences? The answer is no long-term studies have ever been done to answer this question. Lessons learned from the disasters of the past. DDT, once deemed safe, now we know exposure to DDT before puberty raises the risk for breast cancer years later. DES, deemed safe. Now we know it causes birth defects and higher rates of breast cancer and infertility in women and their children. HRT, hormone replacement therapy. Now we know that some forms of HRT increase chances of dying young from breast cancer. Leaded gas was used everywhere. Now we know that through exposure, particularly in young children, it can result in nervous system damage. Tobacco was a joke. 50 years it took us to really admit that it causes coronary, pulmonary diseases and death. The executive director for the New York State Breast Cancer Network speaks for all the members when she appropriately stated our position. Breast cancer survivors are keenly aware that yesterday's reassurances of safety can turn into tomorrow's dire warnings. We won't let that happen again. Time and time again, new technologies are fast-tracked onto the marketplace, causing harmful effects, and we continue to witness our regulatory agencies putting prevention-oriented approaches on a back burner to be argued and discussed. As breast health advocates, we want an aggressive and immediate reduction to specifically harmful agents on the basis of early credible evidence. Earlier, Jennifer shared a map showing the towns that have been able to ban heavy industry within their borders. I live in a beautiful area near one of the largest reservoirs to provide water to New York City, known as the Precautionary. 4 towns were eliminated to secure this pristine source of water. We take our grandkids down to Big Pond, the largest glacial lake in New York State, and teach them all about aquatic life. The Beaverkill River, world known to fly fishermen and naturalists. These are the areas we're discussing. Beaver, trout, eagles, many species of owls, all threatened. The town of Andes in Delaware County was depicted on the map that showcased they successfully banned heavy industry from taking place within our borders. Last week on Earth Day, through the efforts of many led by Earth Justice, the town of Dryden added their name to the list of champion townships. Early warnings should move our government into action. The burden of proof must be placed on industry to prove safety before it is allowed on the market. The gas industry is protected and we are not. Previously, we addressed how many years, if ever, it takes for legislators to pass regulatory action. How can we trust our officials to make the right decisions to protect our health? The answer is not through silence and blind trust, only through programs like this, education, vigilance, and action, and never giving up. Here's a list, just a small list of groups that have a lot of information that our listeners can go to. Tools for action. So here we're seeing that across New York State, look at the people that gathered in areas in Albany and all over the state, making a very big difference. When some high-profile people came on board, that sort of raised the bar a little bit. We're grateful for that. Posters speak 1,000 words. Simple words in a large group can make a very big difference. One that resonated with me was hydro equals water, hydrofracking equals poison plus water. You see that these signs can be put in kiosks. We put them on buses, and here on Long Island, we've put them in the Long Island Railroad. All of that's for free. It's a great tool. Tools for action would be litigation. Earth Justice is quite a leader here, and we're seeing Breast Cancer Action also is taking a pretty big lead. And we spoke before about the town of Dryden just last week. Interactive maps, frac tracker, toxic targeting, all of these sites will provide us with data and resources so that you can learn more about fracking in your area, learn where there's fracking sites that are coming your way, and rally the troops in your community, because it is a grassroots approach that's going to make a very big difference. Call-in campaigns, Americans Against Fracking, New Yorkers Against Fracking. There were national campaigns. Jen, you spoke about it before, and different state campaigns. We're following the New Yorkers Against Fracking campaign that's been very effective. Write-in campaigns. I would venture to guess that many people on this call followed a campaign of Sandra Steingraber's, The Next 30 Days of Fracking. And within 1 month, 25,000 comments were written to the DEC. It was very effective. We all know about the million fracking letters. And again, in Delaware County, where Michael and I share that beautiful cabin upstate, there's a gentleman that had don't frack. His idea was don't frack me. And he said for anybody who leases or owns land, just to put in the amount of acres we own. And I think currently there's over 63,000 acres that say don't frack on me. And it's about today. It is about partnering. So we thank the Breast Cancer Action. We thank Earthworks. I'm sure most of you on this call have made major contributions to the banning of fracking and educating our population. We put together just a pre-slide that it does take all of us doing whatever we can, but most importantly, partner, 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 because together we'll make a big difference. And thank you.
Thank you, Karen. And now I'm going to turn it over to Annie. Great. Thank you. And thank you, Karen, for your really pioneering work against fracking in New York and making the connection between fracking and breast cancer. It is an inspiration for me. So breast cancer action's entree into the anti-fracking movement came last fall, around December 2012, when we discovered that oil and gas company Chesapeake Energy had a subsidiary called Nomac Drilling that started to promote a drilling rig that had been covered pink in honor of breast cancer awareness that they were installing in rural Ohio. And we saw this as a outrageous example of corporate pinkwashing, taking an industry that is linked to breast cancer and using it to promote themselves as a company that really cares about women and women's health by using the pink ribbon. And so we responded by educating our members about the health impacts of fracking and generating over, I think it was 1,800 letters to Chesapeake's CEO demanding that if his company really, truly cares about women's health and breast cancer, then perhaps they should stop pumping toxic chemicals into the earth that are linked to the disease. And so that was the beginning of our fracking work, and we are very excited to be now growing that work beyond this particular instance of pinkwashing. So, okay. So we went on to develop a position on fracking to explain why we would step into this movement. And many of these points have been covered by Karen and by Jen. The first one is quite simple. Breast Cancer Action opposes fracking because the practice exposes people to endocrine disruptors and carcinogenic chemicals that are linked to breast cancer and also linked to other health harms that we also are concerned about. We also know that the health impacts from fracking are not limited to rural communities and that we are all vulnerable because we know that toxic chemicals used in the fracking process can leach into water supplies and reach people living far from fracking operations. We also know that federal and state legislators and regulatory agencies have a responsibility to protect public health from the growing fracking industry, and this is to Karen's point that she just made, which is that we must demand action on fracking in order to protect public health and put the onus of responsibility on industry and on our elected officials whose job it is to protect us. So I went one back. There we go. So again, our fracking work at Breast Cancer Action is still just beginning, but since November last year, we have joined the Americans Against Fracking Coalition and the Stop the Frack Attack coalitions that have both been mentioned earlier. We're also supporting efforts both nationally and in key states to stop or slow fracking. And Jen listed several key legislative and regulatory efforts to close loopholes and protect public health that we are engaging with. We're also working to mobilize Breast Cancer Action members across the country to take action. We have quite a large and committed membership base, many of whom may be on this call today, who are really passionate about making the link between fracking and breast cancer and are eager to stand up to stop this injustice. So again, more opportunities to join in. So we're continuing to build our work here at Breast Cancer Action, and we urge everyone to put pressure on representatives to support state and federal legislation and also regulation against fracking. Folks can also join our email list for updates on our fracking work as it grows, and know that it will grow, and we're very excited to build out many opportunities for Breast Cancer Action members to get involved.
Thank you so much, Annie. I want to take a minute and go over a couple of the resources that all of our presenters mentioned today. And there's going to be a lot of information I'm about to put up on this slide. And I just want to let people know that I will also be sending this in an email. So if you don't get it all down today, it will come to you in a follow-up email. So the first is the fact sheet that Jennifer mentioned that Earthworks has put together. And it shows the key provisions that the oil and gas industry is exempt from. There's key provisions of 7 major federal environmental laws.
And this is the loopholes for polluters, and you can find it at that. You can find it on their website, and that's the exact web address to find it. There's also 2 national campaigns that Earthworks is supporting, which is protecting air and water from dirty drilling, and that's asking people to urge their representatives to support both the Breathe and Fresher Acts. So the Breathe Act would protect communities by requiring oil and gas drilling and fracking to follow the same rules as other industries when it comes to air pollution, to close some of those loopholes. And then the Fresher Act would close a Clean Water Act loophole that exempts oil and gas companies from managing stormwater runoff, which is a basic rule that every homeowner in America is required to follow. There was a map that Jennifer had in her presentation which showed the high-volume fracking, hydrofracking bans, moratoria, and movements in New York State, and you can find that here at this website. And last is the site where you can find the posters, PDFs, and links to the posters that Karen showed, also interactive maps, and many of the numerous campaigns that Karen mentioned. So we're going to be opening it up to your questions in about 1 minute, but before you do, I just want to talk a little bit more about how you can get involved with Breast Cancer Action. As Annie mentioned, you can sign up for our newsletter and our e-alerts to keep up to date on the issues. You can also join us on Facebook and Twitter to connect with others and also help change the conversation about the breast cancer epidemic. You can help others get involved. You can tell your friends, coworkers, and family about this webinar and other ways that they can also get involved. And last, you can donate to support our education and advocacy work. And again, on that note, I want to remind you that Breast Cancer Action relies on your support to make these webinars possible. Your individual support of our work is so crucial. If you've been inspired today, please consider making a donation of $25 or more so we can continue these webinars. You can go to www.bcaction.org/donate, which is up on your screen. I want to give a really big thank you to Jennifer, Karen, and Annie for their presentation today, and now I want to open it up to your questions. And there have been some questions coming in as the presentation has gone on, and I want to encourage you to continue typing in your questions as we try to address them. So a couple of, I guess, clarifications from a few people. One person mentioned that that some of the fracking pads are actually larger than 5 acres, and fracktracker.org actually has some interactive maps where you can see how big frack pads are in different areas. And then someone mentioned that, Karen, you said that radiation is the only known cause of breast cancer. She just wanted you to clarify that. Could you clarify that a little bit more? Karen, are you still there? All right, I'm not sure if Karen's there. I'm not exactly sure what Karen said. I think that she was talking about radiation as a byproduct of the fracking process. And Jennifer had talked about some other chemicals.
Am I on?
Oh, yep, you're there. You're there.
Okay. I'm sorry for the technical difficulties here.
That's all right.
So, yeah,
so
we know that
overactive mute button.
That's right. That's exactly what happened. Radiation is a known carcinogen, so I wanted to clarify that. Thank you to the person who put that out there.
Yeah, and it's not that it's the only known carcinogen, but it was one that we were talking about as it relates to fracking.
Thank you for the clarification. They are right.
Thank you. And let's see some other questions here. So someone has a question about how important is it to distinguish between environmental groups that call for a ban and environmental groups that only advocate for regulations on fracking. So that's definitely an interesting thing. I'll open that up to anyone who wants to take a shot at answering that.
Well, I'd like to take a first shot at it, but others should chime in. My view on the situation is that we can't afford to be either or kinds of groups or an either or kind of movement. The scale and scope of communities that are already impacted by fracking means that if we focus entirely on banning fracking where we politically can ban fracking, then we're going to be leaving a lot of communities behind. And we don't believe that it's appropriate to declare energy sacrifice zones in this country any more than we believe it's appropriate to frack communities where people clearly do not want it to occur. So Earthworks' a position on this is that no fracking should occur, no oil and gas development should occur if it's going to harm water, if it's going to create air emissions, including climate change emissions, if it's going to, if the oil and gas development is going to occur where there's critical wildlife habitat or in places that, some places that drilling just should not occur for ecological reasons. And drilling should not occur if the community doesn't want it. The rights of the community are paramount, and right now they're being trampled. But that doesn't mean that we should leave behind people who are already suffering from this industry. And we prefer to call regulations, rather than calling them regulations, which is the legal characterization, we prefer to call it harm reduction for people who are already suffering from oil and gas impacts. We need to keep oil and gas out of every place that we can keep it out of, and if your community is one of those places, and you can fight with all your might for a ban, and you want to win it, and you are going to win it, then we should all stand behind you. If your community is already fracked, and you are already suffering, and you can get regulations in place that reduce the harm that your community and your kids are right now feeling, then we should all stand behind you. So I don't think it's an either-or proposition. I think we need to do it all.
Thank you, Jennifer. Does anyone else want to chime in on that one?
Well, we know in the breast cancer community, when there is reasonable cause for concern, we have to stop completely before we move forward. We know that in the past, one of the slides clearly showed that we just cannot wait until things are out there in the market to let our bodies prove that they're harmful. We need to stop it in its tracks. And I'm seeing that the breast cancer, from my point of view as a health advocate, that many more disease-focused groups are sort of joining together in this kind of breaking out of the silos, that there are things in our environment that contribute to disease, and that we've got to stop this kind of exposure.
Thank you. I wanted to, Karen Edelson, who worked on the map that we put up, had a clarifying fact, and I just wanted to point it out and thank her for it. She said she developed and updated the map on hydrofracking bans and moratoria in New York State, and she does the work actually through Frack Tracker Alliance, not through the Finger Lakes Land Trust, although she does work for the Land Trust as well. She mentioned that if people were interested in seeing other maps and resources, they could go to the Frack Tracker Alliance website. So thank you, Karen.
Thank you, Karen.
Yeah, there was a question I wanted to get to that someone mentioned. How effective can we be in rescinding the, quote, Halliburton loopholes that exempt fracking from the 7 laws of the land? And Jennifer, maybe I'll pose that to you.
Yeah, well, the Halliburton loophole is the very apt description that we like to give to the loophole from the Safe Drinking Water Act. And there is a law, there is a bill that has been introduced in previous houses that will be introduced in this House federally called the FRAC Act, which will require disclosure of chemicals. And our legal analysis is that if the FRAC Act passes at its strongest form, if it doesn't get watered down, that will make it much more challenging for the oil and gas industry to flout the Safe Drinking Water Act. The language as it stands currently doesn't actually close the Safe Drinking Water Act loophole, but it slows it down enough to make it not work. The other 6 loopholes are all in different states. Our analysis is that the toxic release inventory, actually, sorry, can we get that slide up while I talk through this answer? Does it let me do that? Yeah, it's called Closing the Loopholes. Yeah.
Yep, I will pull it up right now.
Thank you. The toxic release inventory loophole, our analysis is that the EPA has the authority to list oil and gas under the toxic release inventory. About 10 years ago, a group of organizations petitioned to get the mining industry to start reporting under the toxic release inventory, and we succeeded in doing that. So now mining reports, and since then mining, hard rock mining, became the top toxic releaser on the toxic release inventory. So we suspect that oil and gas actually will be worse than mining if the industry is required to report under the TRI. We don't think that that needs a new bill. The other pieces we think do require legislation. The BREATHE Act, which was mentioned I think when Saru covered things at the end, would close the Clean Air Act loophole. I mentioned the FRAC Act would close part of the Safe Drinking Water Act loophole. And then the Fresher Act would close the Clean Water Act loophole. Remaining unclosed loopholes will be the Resource Conservation and Recovery Act, RCRA, the Superfund Law, CERCLA, and NEPA. Those all will require new bills and new congressional champions.
Thank you, Jennifer. There was a comment that I wanted to add to this discussion, that in addition to the methane that's released, there are numerous other chemicals that come up from underground. Someone was pointing out the BTEX chemicals, which is a term used for benzene, toluene, ethylbenzene, and xylene. And some of these are known carcinogens. And as sort of to what Karen was talking about, again, we really have no idea what the health impacts are of these chronic low-level exposures to these chemicals. So thank you for that comment from an attendee. And I also wanted to let people know that we record all of our webinars and post them on our website. So if you want to see it again or send it on to friends, I'll put it up in a couple of days up on our website. You can find that in our webinar on our webinars page. So I want to respect people's time. It's 12 o'clock now, and we're going to end the presentation. And I just want to really thank everyone for their comments, for their questions, and for their attention. And if we didn't get to your question today, you can follow up with us at info@bcaction.org. Again, thank you so much, and I will be sending out an email with some of these resources here in the webinar, and also a short survey where you can provide some feedback on our webinar. So thank you again, and have a wonderful day.
Thank you all so much for attending.